I would like to exercise a modest moderator's privilege by directing a question to Dr. Cranston. That wonderful lightning tour you did of programs around the world, could you identify generally 1, 2, or 3 success factors, they used to call them, things that you found in common that made the difference between a really successful group and one that was still struggling or beginning?
I think the surprising thing was that before I went, I thought fundraising would have been the most important thing, and money would have been the most important thing. But it was really people factors along the way. And so for any support group that I found, you could usually identify the person that was responsible for that group. We know the person in Barbados, we know the person in Malaysia. You know, you can just look. And sometimes those were people who had Parkinson's. Sometimes it was a person whose family member had Parkinson's. Sometimes it was a neurologist physician who brought the people together. But that person, that front person for the organization was usually the most important factor to be able to start the program and continue the program. And I guess the other thing I would say is on the other side is having buy-in from the physicians, from the medical community, because I saw certain places where they were, just not that interested in working with the support groups, and so there was a bit of a barrier getting the patients to the support groups, and then other areas where the physicians were really driving it and making sure that persons that were diagnosed, persons that had needs, got to the support group. So those people factors were the key. And I think that's probably the most important reason that we're all together here now, because we're going to be the key to making any successes.
Great, thank you. Very crisp answer. Any other panelists, anything to add to what Dr. Cranston said about what accounts for success in your experience in outreach? Yes.
Well, I would like to just add that what Dr. Maria said about ownership. I mean, making both patients and care partners feel participants, feel that there is not only programs given to them, but that they have a lot to bring to the table, and that's valuable. And I think that, in my personal experience, has helped us a great deal.
Thank you, Claudia. Any other comments from the panel? Okay, let's. If the panelists have any questions of one another. So
it's me again.
Yes, Claudia. she's the house plant.
It's me again. I was very interested about the promotores or community health volunteers model, and I saw that in India it's been a very successful model. And I wanted to ask if, like in Malaysia or in Africa, is that a model that you use as well?
Any other comments? Yes, is Lou, or is it Dr. Breda? You're pointing to each other. Ms. Lou.
Who goes first?
Okay, let me go first.
Okay.
As I said, one of the measures we've taken to ensure success in Kenya is recruitment of volunteers from within the community. Sorry. Yeah. So one of the methods we've used to ensure success of our campaign in Kenya is through recruitment of volunteers who are within the communities. So that brings about what you've just spoken about, ownership of this. So yes, we're using that model as one way to create awareness within our communities, and it's actually proving to bring success.
Mm-hmm. Sarah?
In Malaysia, I always tell the members and caregivers that they come to our association not to seek help, but they are there to help others. Because by their presence, people with Parkinson's or caregivers, they are able, I mean, we have like social media, we have people out there know that this is a place where they can come and meet people. And then when they come to an association, they start to share experiences. And then they are, in sharing experiences, they're helping others as well. And in helping others, they're helping themselves. So I feel that people with Parkinson's and family members are the very important person in the association.
Wonderful, almost spiritual. That's terrific. Thank you very much. Shall we open the floor to, there's several hands, a frightening number of hands. I believe we have mics parading through, is that correct? I think you have a table over there, gentleman with the beard and the glasses. Identify yourself, please, quickly, as you ask your question.
David Finkelstein from Parkinsons Victoria in Australia. The amazing work of the communities throughout the world coping with Parkinson's and education. My question is to each of you is how are we going to deal with the next 10 to 15 years when there's going to be a doubling of the number of people with Parkinson's? That's a very scary thought to me.
Which one of you wants to start on that one? Dr. Cranston?
I'll just make one comment, and that is, there will also be a doubling of people that have interest in Parkinson's, because now they will have family members, the persons themselves with Parkinson's, and so hopefully, as we build momentum in starting support groups in areas like you've seen today that don't have support groups, we'll just be able to continue that momentum. Because, like I said, as that population grows, more people are going to be interested in actually being involved with support and providing support.
I have
Dr. Brenner.
So what we've been doing in India, and I think what's going to work in India, it's not looking at the medical professionals to work here. It's training resources within the community, and that's what we've done. So it's allied health professionals, community health volunteers, possibly involved in some medical, like government will allocate people for maternal health. So we take those people and add this component to what they are doing. To me, given India and given developing countries, it's the development of resources within the community and what's available that's going to be the answer.
Mm. Very good. Yes, Leslie.
Maybe mic-less, but not speechless. Another strategy that I think is going to be really important as the demographics and the population change is to identify the children and the grandchildren. And I think you had mentioned, too, that this is a family situation. We're seeing more and more young people that want to do something for their parents and for their grandparents. And what a better way than to identify young people, whether they're interested in research or caregiving. Some of the trends that I think are very interesting about families now living together, multi-generational families. So we're seeing very different swings in that. I think that's a good thing. So I think identifying children and grandchildren to get involved is really going to be very important.
Very good. Any other questions? Yes.
I'm
Sarah.
very positive about the future because I have been with the association for 21 years. And I could see the difference, the early years where people with Parkinson's, and my father's time, the generation, people with Parkinson's, they don't want to come out, they're shy. But I could see the difference in the last 5 years and even the last 10, especially the last 5 years. People with Parkinson's, they are more educated, they are more exposed to the social media, they network with each other. And then you could also see the trend at the universities. They're sending their students to our association in the community-based project. These people, the students, they are going to be future healthcare professionals, and they are more exposed to Parkinson's. And at the same time, they also do research. So I feel that as time goes by, more people are aware about Parkinson's, and more people will be involved. Even family members. Thank you.
Very good. Thank you so much. Other question. A gentleman in the middle.
My name is Reikaldan, and I am the president of Association Anti-Parkinson Romania. I want to congratulate the organizer for this meeting, and I want to share a movie, a very short movie. It is my question because how mentality of civil society you pass. And please give the movie.
Not sure I caught the end of that. think we probably, if it's a question of a movie, we should delay that probably to another part of the program. We only have a few minutes more, but let's put that aside. And so, right after the session, perhaps you and I can talk with the managers of the convention, and we'll find a space for that. Other questions? I think it's yes, a lady. Yes, Mariela.
Hello, everyone. Thank you, like everybody. It is fantastic and a very good start of the whole event. My name is Mariela Graciano. I'm a physiotherapist, and I represent the Association of Physiotherapists in Parkinson's Disease Europe. A specific question to the people who are dealing with Spanish. Have you considered contacting the many associations of South America who are dealing with Parkinson's disease? I'm sure if you do that, the map we saw about the spread of contacts will grow into South America, which at the moment is empty.
Well, I'm so happy that you asked that question because, yes, we have. At the Muhammad Ali Parkinson Center, we developed a very strong network with all Spanish-speaking countries. I can say almost right now we're up to 15 different countries. And if you attend tomorrow the welcoming reception, you're going to be able to see a lot of their faces of this, not only organizations, but individuals that we are in touch with thanks to social media and thanks to the fact that now our webinars are done via webcast and shared live with a lot of these organizations and individuals. Plus, right now, I mean, probably you saw one of our volunteers, Ruby, who is here. She was, taping live. We were using Facebook Live, and my presentation was webcasted to all of them as well. And I also invite you to go on Friday. There's a poster that is, the title is Art as a Way to Represent the Spanish-Speaking Community. And there is a map, as you said, of all the countries in South America who participated. The concept was very simple. With the help of our art instructor, he built this drawing that is 3 flowers with a tulip in the center representing Central, South, and North America. And each patient, our caregiver, was invited to paint it and take a picture and return it to us. And that way we build a mosaic with all their paintings that represents them. And so that's a way for us to
I think it's an extraordinary contribution. Thank you.
You're welcome.
Thank you. The lady on this table here, 2 tables back.
Oh, hello. My name is Samantha L Andheri. I'm from Parkinson Voice Project, and I want to thank WPC for providing this opportunity, and I want all of you up there to know how much I admire what you're doing. We're spoiled in Dallas, Texas. We have so many resources for people with Parkinson's, physical therapy, speech therapy, lots of doctors. And I'm sitting up here and I took so many notes while all of you were speaking because I think that we can help you. Those of us that have so much, there are lots of things that we can do to help you, and I want you to know I will find a way to help you because in my case, it's not with the doctors or the medicine, but the speech therapy doesn't require any medication. All we need to do is teach people how to speak better, and so we just need to get the training to the people, and you have opened my eyes, and I really appreciate it. Thank you very much.
Lovely. Very generous, very appropriate. That was a comment, not a question, so we will proceed with, I think, a couple more. Who else do we have? I saw 2 or 3 hands in this area of the room. They gone away? Yes. Gentleman there. And then the front table. Sorry.
Is it me? Okay,
Yep,
thank you.
you.
Hi, I'm Dominic from the European Parkinson's Disease Association. Like everybody else, thank you very much. Wonderful presentations. I've got a question for Maria. It sounds like you're doing absolutely amazing work on very little or no resources out in India. And it seemed to me that you were doing a lot of multi-stakeholder work. You were getting lots of different partners to join together. A, did you find that difficult, particularly with the corporate companies that you mentioned? And B, you talked about the replicating successful projects wider in the country. If you could give us any kind of update and in terms of how that's going and how have the replications kind of proved successful and.
Okay, thanks. Yes, getting corporate India in was really difficult because firstly, they knew very little about Parkinson's and everybody was funding cancer, AIDS, those kind of programs. But what really worked for us was when we went out to them and we presented the work we do, and when we mentioned to them that at the World Parkinson's Congress 2013, our model was appreciated and was kind of looked at, that kind of gave us greater credibility than all the work we were doing. So they said, okay, these people know what they're doing, you've reached an international platform, so possibly you are in a position to be funded. It gave their organization an opportunity to talk about a model that had international recognition. So that was a strange way that it worked, but that's how it worked. Additionally, India has now come up with something like corporate social responsibility. So we're trying to get an edge in there. So that was what worked in the rural project, where we found a steel company worked in rural India, and they had people from the community working at their organization. So we said, you know, you're kind of going to give back to the people you work with and things like that. So we had to identify what they needed to do, but it's very specific to organizations where they work and what they want. So we've got to tailor what are their needs and accordingly write the project. And the second question, yes, was replicability, because we realized that was where our expertise lay, and nobody else was doing stuff for Parkinson's. So we developed this program, and because we gave it a research edge, we documented it, and therefore it's been replicable. But what we do is we adapt it, because though we are all Indian, and that's the only common denominator, every part of the country is different culturally, linguistically, socioeconomically. We have varied backgrounds from rural to tribal. So we have the basic model, we adapt it. So that's where replicability has really worked for us.
Thank you. Very fine, rich answer. Anybody else have any answers? For those who don't know the last questioner, he and his mama, Lizzie Graham, created actually the first of the multinational Parkinson's initiatives through the European Parkinson's Disease Association, which preceded WPC by several years. And Dom, you and your family did a great job in spreading that word and starting many things, a pioneer in our field. Gentleman to my left here had his hand up. Could somebody find a mic to him? And we have maybe time for one more question without poaching too much on our coffee break. All right. So this lady, and then the gentleman to my left.
I'm Pinky Agrawal, and I'm from the Seattle, Washington area. And I was wondering if clinical trials or drug development didn't come up, and I was wondering if that's something that's being discussed now, especially Mumbai, we know, has a lot of biotech pharmaceutical companies, and so are you having success? Are clinical trials being conducted? How are you doing in terms of recruiting for the trials? And with your community outreach, is that helping you with recruitment and drug development?
Yeah. There are clinical trials happening in Mumbai, but we've kind of distanced ourselves from any specific neurologist or clinical thing that's happening. We need to think about it. I mean, that is an issue, but I think we need to know the how, because Indians are very skeptical. So if you bring up something and say that, okay, this is a clinical trial, they're always wondering, do you have another agenda? Currently, we have high credibility because they feel the only agenda we have is helping them in the quality of their lives. So a great deal would depend on how we approach the subject and how we deal with it. But I think it is a possibility.
And how about any of the other countries?
Leslie?
No.
Just one resource that we have. We've done a webinar on clinical trials, because we find the same thing. It's about educating people on what is a clinical trial, the different types of clinical trials, and how to get people involved. We haven't specified for specific subpopulations, but I would encourage you to go to our website at the American Parkinson's Disease Association, and there's a webinar that's been archived on just general information on how we get people recruited, if that was your question about recruitment. Thank you.
Yeah, and for us also, we've been trying to educate more the Hispanic community about the importance of participating in research, and why is it, why is a way for them to get access to better services or to get represented, but as Maria said, is the same thing as a lot of reluctance, and it's not something that will happen, in the short term, but it's something that you have to build on. And there's a poster that we have that talks about that, and that we use one of our support groups, which actually is not called a support group, it's our Comadres Compadres group, which means like good pals or good friends. And it's as a way that for us, we've been introducing the topic, and in our latest newsletter issue, or newsletter in Spanish, is dedicated to research. So it's starting from little by little, kind of engaging the community on talking about it and seeing what's in there for me. It's not just about medications. It's because many times, for them, research is that they're going to, I'm going to be the guinea pig, or I'm going to be, they're going to be trying these things, and that they don't want to try in somebody else. They want to experiment with us first. And so that is a great matter of getting them educated and finding what are, their perceptions and what is in there for them that we need to work to make it, valuable for them as well. So, and we're going to start little by little. For example, as I said, not medical trials or not nothing related with medications, but with voice, like Samantha was saying. So we're doing a research project with a local university, with Arizona State University, about dysarthria in Hispanics with Parkinson's disease. So that's something that I think it's going to be helpful for them, making them understand that there's a lot of research that can be done and that their participation is valuable.
Great, thank you. We're a bit over time, so one more question, the gentleman to my left.
Thank you very much. My name is Meng. I'm from Malaysia, the eastern part of Malaysia, of the Borneo state of Sarawak, Cebu Parkinson Society. After listening to Claudius on the particular support on the Spanish community, I have a question whether you also extend your service to the indigenous people or the native people. Because I found, I work in Malaysia, I work with the native people, but we do not find any native people having such a disease. I also have visited the North California climate area, to Europe and Hopa community. And I asked them, they said they don't have any Parkinson's disease. Whether this is a genetic reason or this is also some, particularly with the lifestyle, that maybe some preventive answer can be found from that. Whether such a study has been done by any group, I'm not sure.
Yes, well, actually, it's a very interesting question, because we at the center, we've partnered with the Navajo community. There's a lot of large Native American population, but it's difficult to kind of participate if you don't have somebody belonging to that community. And we had that opportunity with the Navajo Nation. We had a patient who was very interested in helping us outreach to their community. And we used the promotores model. The flip chart that we have and the whole concept was adapted and reshaped to their culture. So we were working with their community health workers and working with the whole concept to making it culturally sensitive. And so now there are trained promotores belonging to the Navajo community who are helping outreach and educating the people in the Navajo Nation. I'm sorry? Yes, there is Parkinson's disease among the Native Americans as well.
Thank you. On that note, I think we will close this wonderful meeting. I want to join everybody in congratulating and thanking our wonderful speakers. And I also encourage all of you to continue the good tradition of these conferences, which is to badger the panelists mercilessly when you see them in the hall and continue the conversation through the small hours of the day. Thanks, everybody. Thanks, the panelists. Thanks, the organizers. Great session.